Most people would think that as a dietitian, I would be very against weight loss drugs. However, I've seen them work. But are they safe, effective long term, or just another empty promise from the drug companies to make billions? In this video, I'll unpack everything that you need to know about Wegovy and Ozempic and what to consider if you're thinking about taking them. If you're new here, welcome. I'm Maria and I'm a board certified dietitian in Ireland and Bermuda. And I'm here to help you understand nutrition and find a way of eating that works for you. So if that sounds good, please give the video a thumbs up and don't forget to subscribe below as it really helps support the channel. TikTok posts on Ozempic have over 1.2 billion views, with Elon Musk crediting them for his weight loss and them even being mentioned at the Oscars this year.
When I look around this room, I can't help but wonder, is Ozempic right for me?
And look, weight loss is hard. People have been trying to lose weight with years. And with all of our advances in artificial intelligence, ChatGPT, isn't it about time we had a weight loss drug that worked? And now we have Ozempic and Wegovy. Okay, so before we get too excited, I'm going to jump right in and say that it is not a magic fix for weight loss. But what it is another tool in our toolbox for helping people with managing their weight. I'm not pro or against Ozempic, but I am pro patient-first, patient-centered approaches. And for some people, it's something that they want to consider. I've had many clients say, and I'm sure many people can relate, that they have tried everything to lose weight and nothing has worked for them. And this might be something that can finally really help them. It is not for someone who wants to lose 5 pounds before their next holiday. There are lots of things that need to be considered because it is a drug and it needs to be taken seriously. No, it is essential that these medications are used in conjunction with healthy eating, exercise, and behavior modification. It is not as simple as take these drugs and you can still just eat whatever the hell you want. It does not work like that. And I'm not just saying that because I'm a dietitian. The medication usage without these changes is generally ineffective, does not work, and can make you in a worse position than when you even started. Check out this video, which I'll link in the description box below, which shows how diet and weight cycling can be very damaging. But ultimately, you might lose weight, lose muscle mass, then put the weight back on, but you've also had all of these metabolic changes that will make your next weight loss attempt even harder. It even says it on the labels of these drugs, to be used in adjunct with diet and exercise. But in this video, I'm going to unpack everything. As always, on this channel, the aim is to inspire and educate you to have informed conversations with your healthcare professionals, if it is something that you have been considering. So what is the real goal here? If your goal is weight loss, the real goal is that you want to lose weight and keep it off for the long term. You also want to improve your overall health. These drugs are not for cosmetic purposes. And you want to minimize any adverse effects. Ozempic and Wegovy are the same drug, but at different doses. They are both semaglutide drugs, which is the active ingredient. And Novo Nordisk creates 2 different branded drugs using this ingredient. So Ozempic was the first semaglutide drug on the scene and was initially made for people with diabetes. It's actually been around a while, and all along they've been doing trials and they've been seeing that it's been helping people to lose weight. This led to people starting to prescribe this drug off-label for weight loss purposes. And that's when we started to see it running into short supply, because people who didn't have diabetes were going to their doctors trying to get this prescribed to help them with their weight. And like any smart pharmaceutical company would do, when Novo Nordisk saw that it was working really well for weight loss, they rebranded essentially the same drug as Wegovy. And Wegovy was approved in 2021 by the FDA as a weight loss drug. So it's not just a drug for diabetics, and it goes up to a higher dose of semaglutide. Now we have the competitor Eli Lilly coming off the tracks with Mounjaro, but that is a topic for a whole other video. So make sure you're subscribed so you don't miss when that's released. I'm going to jump in here and let you know about my free recipe ebook, which you can download via the link in the description below, where you can learn to make lots of recipes like this. These drugs are GLP-1 agonists, which means they act similar to this hormone in our body. And this hormone has a multitude of benefits, but in short, what it does is it helps slow down food absorption in the stomach so you feel fuller for longer. It regulates insulin and blood sugar by stimulating the pancreas. And most importantly, it helps tell your brain that you are full, suppressing hunger, reducing cravings, and helping people feel a lot more in control of their food intake. It's been shown to reduce calorie intake by 35% without changing people's perceived hunger levels throughout the day. So basically, you can eat less and not feel hungry. Now, this is game-changing in the dieting world, because typically people who have lost weight experience more food cravings and less satisfaction after eating, which in turn can derail any long-term efforts. So the takeaway is that these weight loss drugs, they're not magic. They still require a calorie deficit to work, But because of the impact on how full or hungry you feel, they can make obtaining that calorie deficit and sticking to it a lot easier. So it is not take this drug and still eat whatever the hell you want. And if you do, remember they slow down gastric emptying. So you're just likely going to feel awful. And you're going to have a lot more side effects like nausea, vomiting, diarrhea. So the medications are typically administered through a once weekly injection, and you start at a low dose, it might be something like 0.25, and then after 4 weeks you usually build up. And depending on how you tolerate the drugs in terms of its effect and in terms of side effects, you might build up to a higher dose over time. So typically, these medications are prescribed for people with a BMI over 30, or if your BMI is 27 or higher but you have another health-related comorbidity like diabetes or hypertension. Some guidelines actually recommend higher BMIs than this again. Yes, they do work, and that is why there has been so much hype. Most studies on semaglutide suggest that it can result in 15% weight loss when paired with diet and exercise, which is pretty dramatic. The weight loss drugs that we've had in the past have only ever managed to result in 5 to 8% of weight loss, and they had a lot of nasty side effects. But when you stop taking the drug, the effects also stop. And for some, this means that the weight creeps back on. I'll come to that shortly. Of course, try all other interventions first. But I want to emphasize that I want my patients to feel like that they can chat openly with me. Some people can feel shame if they feel like they have failed at traditional weight loss methods. And there can be a lot of stigma associated with taking these drugs. Some people think it's a lazy approach, which is not necessarily the case. These drugs are around and people are going to consider taking them. So I think it's important that we can have open discussions about them. I always want my clients to feel like they can openly talk to me rather than Dr. Google. And there is a lot of black market drugs mimicking these, which can frankly be very dangerous. Now, there are some considerations that your doctor will likely go through with you before starting on these medications. First is, of course, a risk-benefit analysis, and this is not unlike any other drug if you were to start birth control or an antidepressant. Medicine is all about risk and benefit. It's all about weighing the potential discomforts or risks with the potential benefits, both immediate and long-term. Your doctor should also, of course, as I've mentioned, make sure that you've tried all other lifestyle interventions first. And then, not every drug works for every patient. Individual responses vary widely. We all metabolize drugs a little differently to the next person. I have seen some people who these drugs have worked very well for, and for others, they have not worked at all. Some people just continue to eat past the point of fullness. Next, a plateau is reached once the maximal therapeutic dose is achieved, and weight loss ceases. This does not mean that the drug has stopped working. It simply means that if you want to lose more weight, additional strategies will be required. Finally, when the drug is stopped, weight regain can be expected. And most people don't want to be on this medication long term, so it's something to really consider. Now, I have some other points I want to highlight that I'm particularly concerned about as a dietitian. And any good doctor that prescribes you on these drugs will not just forget about you, they should also be referring you to dietitians and to a wider healthcare team to support you on this journey. So my first consideration as a dietitian is that we need to be smart with weight loss on these drugs. You might see that your appetite is low and you decide, this is great, I'm just going to roll with it. Suddenly you're only eating 1 or 2 meals a day and you think that it's really working, I don't have an appetite. But you might be making things more difficult down the road by doing this. Working with a dietitian can help you make sure you don't lose your valuable muscle tissue. With any weight loss, you are likely going to lose body fat and muscle, but it's trying to minimize the amount of muscle that you lose as much as possible. This will help you in the long run because muscle burns more calories than fat, and you will have a higher metabolic rate if you hold onto your muscle. So if you stop taking these drugs and you start eating normally again, you're more likely to put all the weight back on and additional weight because your metabolism will have adapted in a negative way if you don't approach this with care. To get the most out of Ozempic, you need to commit just as much to diet and lifestyle. So you need to be making sure that you're eating adequate protein and that you're doing some resistance exercise to help keep your muscles. And these are just some practices that you're going to have to learn about in the long term to help support you lead a healthier life. My next consideration as a dietitian is about your mindset. This is not a quick fix or an easy solution. You need to be approaching this correctly and be ready to engage with a healthcare team to support you. You want to use this time to learn about all of your behaviors that haven't worked in the past. Do not just get a script online and go on your own. If you're taking this seriously, you cannot just ignore all of the other factors that have led you to having additional weight that you want to lose in the first place. My next consideration that some people forget about or simply don't understand is that if you do lose weight, you are now a smaller human being. And a smaller human being does not need as much calories as they did when they were larger. So it's unlikely that the amount of food that you were once able to eat to maintain your weight, that you'll be able to return to this. Once you stop a diet, and if you've successfully lost weight, your needs don't just go back to where they were pre-diet. My next consideration, and this is an important one, is that once you lose weight, the hormones that control appetite change, whether or not you've lost weight with the help of a drug or not. I've discussed this in my diet cycle video, which I'll link below, but essentially when on a diet, our body fights to maintain body weight homeostasis. And it does this by increasing appetite and thoughts about food and decreasing our satiety hormones in a desperate effort to make us eat more. It's a survival mechanism from our ancestors for when we had to live through times of famine and food shortages. And this is why some people favor using these anti-obesity medications longer term. Because without a medication like Ozempic, the body is programmed to ramp up your appetite with every extra pound of body weight that you lose. And these hunger and fullness adaptations can last well past a year after a diet has ended. So this is why behavioral change, regular follow-up, and support are important here in this weight maintenance phase. I would argue that the weight maintenance phase is even more important than the weight loss phase. Look, this depends. A lot of people doing this with a lot of motivation do want to come off the drug eventually. And in some health services, you will only be given a prescription of these drugs for 2 years. After stopping the drugs, the effects will cease. And research shows that 1 year after discontinuing these semaglutide drugs, that participants can regain 2/3 of the lost body weight. Some patients may be able to gradually taper off the drugs whilst maintaining a healthy diet and exercise routine, but it can still be a challenge. The clients that I have seen come off the drugs and maintain their weight loss have been dedicated to sustaining these new habits that they have built, like making exercise a part of their day-to-day routine and making better food choices day to day. An example that I came across recently was the TikTok creator Remy Bader. And she said that she tried semaglutide but gained double the weight back on and made her binge eating even worse. And this just highlights the need for a multi-pronged approach when it comes to taking these drugs. There can be a lot of disordered eating when it comes to struggling with weight and body image. And if you are taking these drugs, this is a good time to address any underlying issues that you have around food and to work on the behaviors that could sabotage you when you come off the drug. So we don't have any long-term use studies at this point to know about the long-term side effects of using these drugs for weight loss, which is very important to be aware of. Now, these GLP-1 receptor agonists have been around for a while with diabetes, but what is very important to mention is that the people who want to take these medications but they don't fit the criteria, so for example your BMI is 26 or you just want to lose 5 pounds for a holiday or a wedding, there is no research for that. The research on these drugs has been done in people with obesity or weight-related comorbidities. If you don't really need to lose weight for health benefits, there are no studies to try and figure out what the risk-benefit ratio is. And this is because the goal here is to help reduce the health consequences related to obesity. They're not cosmetic drugs. So side effects of Ozempic, they vary according to the individual. The most common side effects that we hear about are nausea, vomiting, constipation, diarrhea, reflux, overall GI upset, dizziness and headaches. Thankfully, most people report that the nausea and these side effects steadily decline over time, but for some people they are completely debilitating. This is why the dose is often started low and then increased as tolerated. So you may not be a great candidate for these drugs if you already suffer with slow gastric emptying, suffer from acid reflux, or if you already have any GI issues like IBS or IBD. More serious potential side effects like thyroid cancer have been seen in animal research, so they're contraindicated for anyone with a personal or family history of thyroid cancer. Other issues seen are pancreatitis, acute kidney injury, or gallstones. So these are all conversations to be had with your doctor. Semaglutide is also contraindicated during pregnancy, and you should stop taking these drugs at least 2 months before you plan to get pregnant. Cost is also a really big thing for people, and this can depend on where you live and your insurance. Obesity is complex. There are genetic, behavioural and environmental factors that all come into play. And it really isn't as simple as we have been led to believe. In an ideal world, I would love if diet and exercise could be enough for everyone. And it should always be the first approach. However, I have seen many people try and really struggle. And I have seen some beautiful cases where these drugs have really helped some people change their lives, improving their physical and mental health. I cannot emphasize enough though that they need a huge amount of support. Do not do this alone. Diet, lifestyle and psychological intervention need to be considered. Because at the end of the day, what good is it to lose all your weight and then put it all back on? I won't ramble on anymore. If you have any questions, please just comment below and I'll do my best to answer them for you. And please also comment and let me know what you think about these drugs. And if you enjoyed the video, make sure you give it a like. Don't forget to subscribe and check out some of my other videos that I'm sure you'll enjoy also. Thanks for watching.